When people hold your hand, when people smile, when the nurses smile, when the people come into the office, it makes all the difference in the world. It makes all the difference in the world. It encourages a person, encourages them to keep moving on in a positive way.
The mission of the Institute for Liver Medicine is to ensure high-quality liver care everywhere throughout the system, at all of our hospitals and all of our clinics, all over the metropolitan area. We see patients from the beginning of their liver disease with undiagnosed minor issues to very severe liver diseases that most places would not be able to address.
We are a full-thickness center of excellence for clinical care and clinical trials to define new therapies to improve our patients' lives. We've been an international leader for decades with major excellence in clinical care and research. We've helped define the current therapies for hepatitis C and B through clinical trials.
Dr. Dietrich and their staff worked together as a symphony to bring about change in my life. Mount Sinai had everything to do with turning my whole situation around.
Floyd is a miracle baby, frankly.
One of the things I noticed along the way was I felt a twitch, not a pain, but what I thought was a muscle spasm in my abdomen area.
Floyd was a typical hepatitis C patient. He didn't have any symptoms, which is why it took him so long to come in to be evaluated for treatment. And that's the story for most patients.
When I learned I had it, I didn't know how dangerous hep C was.
When Floyd first came to see us, it was pretty evident that he had serious liver disease and he had hepatitis C. And he wasn't sure about whether to get treated or not, so we persuaded him.
Dr. Dietrich said, you know, you had 10 days to live when we found out what you had. And that was 8 years ago.
We treated him and it was successful. He was cured. Unfortunately, his cirrhosis was not cured, and it can eventually lead to liver cancer. It was pretty advanced. But we didn't give up. We immediately sent him to the best liver cancer group, probably in the country, here at Mount Sinai. And they went to work immediately on Floyd's liver cancer.
All liver diseases occur in conjunction with other illnesses that require expertise across many domains.
I think what's so great about us is we built a relationship with so many different departments. Liver disease is not solitary, it's works with other departments. You know, we work closely with endocrinology for our patients who have diabetes and fatty liver. We work with OBGYN where women are getting screened for viral hepatitis and maybe have complications in pregnancy. Unfortunately, patients get liver cancer, so we work closely with interventional radiology and hepatobiliary surgery. We have these connections and we're able to work so closely with them.
We saw how serious it was, which really made us run to take care of him. And I think the group banded together, and Floyd felt that compassion and caring that all of us, you know, we were going to give our best shot to cure his really bad disease. Come on down.
Okay, let's go.
Floyd was very lucky that he came when he did. Despite his really serious prognosis at the beginning, today Floyd is cured of his hepatitis C and cured of his liver cancer. It's really remarkable.
I get a little emotional about it because he's been around now for 7 years, and when we first met, we didn't really know how many years he was gonna have.
Do the liver walk.
He loves this too
Yow.
much.
It's important, frankly, to get your hepatitis C treated immediately as soon as you know about it, because you never know what's lurking underneath.
It's been a journey, but for myself, along with the patients. So I've had hep C. I was a patient of Dr. Dietrich's before I started working. And it's definitely helped me to bond with the patients. Unfortunately, I had to go through the bad old days with old medications, whereas now it's pretty easy. We have a couple different regimens, and we can get 99.9% of patients drug in hand, and if they're willing to take the pills, they can achieve a cure, just like me.
We are not passive in this fight against liver disease. Here at Mount Sinai, in addition to these clinical trials, we have some exceptionally talented world-class scientists who are working hard to uncover mechanisms of disease that will unearth for us. We're on the threshold of a new era of new treatments and improved lives for our patients.
For you, things are good. I mean, if your tumor has been stable, from our standpoint, it was the immunotherapy which did the trick. From your standpoint, it may be a prayer that played a part as well.
Science and faith work hand in hand.
If you do not have people who care, I'm not just talking about putting up with you, but I'm talking about people who love the fact that they want to help you. They don't know you, but they're compassionate about performing their job to be a blessing to your life. If you don't have that, your chances of getting sick and dying are tenfold.
Floyd now is doing wonderful. He is living his retirement, doing his photography. His hep C is cured now. His liver cancer is cured. I think Floyd really made Mount Sinai shine.
I'm just grateful, you know. You've been a blessing to my life. Thank you, man. If you're looking for a place where you can find love and care from people that really believe what they're doing, Mount Sinai is the place to go.
The past is part of what got you here, so maybe finding us will be the hope in your life and maybe change everything.